Hello, my name is Dr. Elliot Hirschhorn and I want to welcome you to this video. You're probably watching because either you or someone you know is suffering from thyroid-like symptoms, things like the inability to lose weight despite diet and exercise, extreme and chronic fatigue because you're not sleeping, you have insomnia, you can't fall asleep, you can't stay asleep, you have temperature regulation problems so you're always cold or you're always hot. You have things like cramping and bloating in particular after you eat food, and you have sometimes chronic diarrhea, constipation, goes back and forth. You have anxiety, depression, mood swings, and you have brain fog. So when you walk into a room, you get into the room and you're like, what am I doing here? You can't remember things and you have problems with short-term memory. I want to encourage you that if you have any one of these symptoms and you have a diagnosed thyroid disease, or maybe even not, and you're just suffering from these symptoms, you're definitely in the right place, and there is hope for a natural way for you to overcome these symptoms. So keep watching this video. We're going to be talking about what we do and how it is different from any other doctor you may have been to, and we'll share some success stories with you with actual patients that have literally had their lives changed. Most of the patients that come into our office, and this may include you as well, are really just frustrated because they're not getting the answers that they're looking for. We're going to talk about your thyroid today in ways you've probably never heard before. You're going to learn things you didn't know before about your thyroid, how it works and how it stops working. And we're going to talk about exactly how your thyroid condition can be helped. And I want to encourage you once again that there is definitely hope for your situation. So continue to watch this video and take lots of notes so that you'll have a better understanding of your particular situation. So what I'm going to do today in this video is I'm going to talk about what we do in our office. We're going to talk about how that is different. We're going to compare it to the standard medical model of care for thyroid conditions. We're going to talk specifically about how the thyroid gland works so that you have an understanding of what it does when it's healthy. And then we're going to talk about what happens when it malfunctions and the thyroid stops working properly and it stops producing thyroid hormone, and it causes a lot of the symptoms that you may be experiencing. We're also going to talk at the end about how, if you're interested in having a one-on-one consultation in our office, you'll be able to do that after you've finished watching this video. I want to encourage you that in our office, we literally leave no stone unturned in determining the exact underlying causes of your symptoms. And so as you go through and you watch this video, you'll see all of the different testing that we do to figure out exactly what is that underlying driving force that's causing the symptoms that you're experiencing. So who am I? My name is Dr. Elliot Hirschhorn. I'm a board-certified chiropractic neurologist, one of only 3 in the entire state of South Carolina. I practice functional neurology and functional endocrinology, or functional medicine, and we find that when we put these 2 fields together, we really do get the best results for our patients. If you've never heard of functional neurology, if you've never heard of functional endocrinology or functional medicine, you'll have a better understanding of what these 2 fields are as you go through this video and we talk about how we approach our patients. I also practice under my PMA license, which allows me to provide the best possible recommendations for my patients and also keep their health records private and secure. A lot of times patients come into our office and they're concerned because as a traditionally trained chiropractor, they may be thinking that all I know how to do is, help people with their back and neck pain, crack back, so to speak. So if you've had that perception, or maybe someone has discouraged you from listening to this video or coming into our office because they're telling you, oh, he's just a chiropractor and all he knows how to do is crack backs, I want to explain to you the education that I have as a chiropractor and how that compares to education of medical doctors in medical school. Obviously, I've gone through chiropractic college, so I know firsthand what's happening there, but I also have family members that have gone through medical school, so I'm very well aware of what happens in medical school and the training that they receive as well. So in chiropractic college and in medical school, the first 2 years are all of the basic sciences, and so we're learning about how the body works and what happens when it stops working properly and the disease processes that can result from that. So we're learning things like anatomy and embryology. We're learning things like physiology, which is how the cells of the body actually function under normal circumstances. Then we learn pathology, which is what happens when the cells stop functioning properly. We learn things like chemistry and biochemistry and microbiology. And then we learn diagnosis. Diagnosis is really important because this is where we learn to figure out what is the exact underlying causes of the situation that the patient is dealing with. What are the underlying causes of the symptoms that you're experiencing? And so let me give you an example of a patient that might come into a traditional chiropractor's office for like a back pain or a neck pain type of situation. You know, back pain and neck pain might not actually be an actual problem with the back or the neck. So for example, an older gentleman that has a history of prostate cancer, he could now have metastasis from that prostate cancer to his spine causing low back pain. And my job is to figure out what is the actual cause of the pain. Is it a low back musculoskeletal issue, or is it due to metastasis of the cancer? That's diagnosis. Same thing for thyroid disease. As we go through and we talk about the symptoms of thyroid and what the potential causes are, you're going to learn that a lot of times thyroid symptoms and thyroid disease is not actually a problem with the thyroid gland itself. There are a lot of other multiple factors that can play into this, and you'll learn and we'll uncover them as we continue through this discussion. Neurology, 149 hours to 171. I have an additional 400 plus hours of neurology as a board certified chiropractic neurologist. And as you'll see in a few minutes, the thyroid metabolic processes start in the brain, and so that's why we evaluate all of our patients neurologically as well as from an endocrinology point of view, because yes, the thyroid gland is part of the endocrine system, but the first two steps of thyroid physiology start in the brain, so we have to evaluate a person neurologically as well, and we'll get into the details of that. We learn things like psychology and psychiatry and obstetrics, gynecology, x-ray, orthopedics. Basically, bottom line is that we have over 2,000 hours in the basic sciences in chiropractic college and in medical school, so we're learning the same exact things. It's the application of that knowledge that differs in the years 3 and 4, where in medical school they're learning pharmaceuticals and medications and surgeries and things, and in chiropractic college we're learning chiropractic techniques and nutrition and things like that. And so you can see that we have a very similar education. We understand how the body works. So this goes to that point that yes, we can, based on our training, help you with things other than just back and neck pain. More importantly, let's stop talking about me. I want to talk about who are you. Most likely, if you have these symptoms, you're experiencing a chronic condition, and that's what we help people with. We give hope to people with chronic conditions that have been dealing with these things for years and years. I want you to think about two things that you can either start doing or stop doing that could improve your situation, that could get you back to being healthy again, that could return you to your old self again. And I'm sure that's probably one of your goals. So take just a moment, think of two things you could either do or stop doing to improve your health. Okay, now probably you did not think of, let me take a medication. And in fact, I asked that question for most people that I speak to, and no one yet has said, I'm going to take a medication. And the reason why is because you cannot medicate your way back to health. Medication is vitally important for many situations, but for chronic diseases, it does very little to get people back to optimum functioning lives. We're going to talk about that and compare and contrast the two different approaches as we continue our discussion. A quote I want to read you says that modern medicine is excellent at providing care for acute diseases, things like strep throat, bronchitis, pneumonia, urinary tract infections, and acute surgical emergencies. The medical system, however, lacks an understanding of and treatments for a myriad of chronic diseases. This is not an alternative practitioner saying this. This is a medical doctor who lives and breathes and works in this field and has a great understanding that yes, the medical system in the United States is the absolute best place to be if you have an acute situation, if you have an acute life-threatening infection, if you break an arm, if you have a heart attack or a stroke, or acute kidney failure or something like that. You need to be in the United States in our medical system here to get the absolute best care possible. But for chronic diseases, that approach just doesn't work. And it doesn't work, and that is evident based upon the fact that we see people coming into our office all the time with things like diabetes and thyroid disease and chronic pain and autoimmune conditions and all kinds of things, ADHD, and they're coming to us because they have not gotten the results that they're looking for. They have not gotten their questions answered. And we provide an opportunity for people to really get their lives back through an alternative approach, and that's what we're going to unravel and reveal to you today. If you want help for your chronic condition, we have to think outside of this pharmaceutically insurance-driven model. And I'm going to repeat that over and over again because in the medical world, the standards of care, so to speak, what protocols and algorithms a medical doctor has to follow are really driven, yes, by the research, but the research is done on pharmaceuticals, paid for by pharmaceutical companies, and then who determines the access to that is the insurance companies based on what they're going to pay for. So it's really driven by pharmaceutical companies and insurance companies in regard to what care you can get, what testing you can have done. And so if we want to step outside of that box and actually get better and improve our health from chronic diseases, we have to step outside that box and move away from the pharmaceuticals, move away from the insurance driven model. So sometimes patients are going to have to dig into their pocket. I'm not going to sugarcoat it. I'm going to be right up front and honest with you. It's going to cost some money, and you're not used to that because we're stuck in this pharmaceutical insurance-driven model where insurance subsidizes everything. And I'll go through some costs a little bit later in the video so you can get an example of what it would typically look like to get your life back. And that's really the most important thing, though, you got to keep in mind, is getting your life back. So let me give you an analogy. Let's say you've been eating at a restaurant for 10 or 15 years. The food's really good. You go back every week. You know the people there. You know the other patrons. You have a good time when you go in. But all of a sudden, the past couple of months, the food has just been making you feel not so good inside. You keep going back. You know the people. And more importantly, actually, because you know the owners, they basically give you the food for free. So you're eating all this food, and you don't have to pay for it. So that's a really good, attractive benefit. You don't have to pay for the food, but it's getting you sick. Do you really think it's a good idea to continue to eat at this restaurant, eating food that's making you sick just because it's free? Most likely you would not continue to do that. But that's really an example of what the medical system is doing for chronic diseases. At best, you're just managing and maintaining the status quo. You're not getting any better. Sometimes people get worse, unfortunately. But if you want to get better, you have to stop going to that same thing and doing the same thing over and over again. Just like with the restaurant example, you don't want to keep eating that food that's making you sick just because it's free. You don't want to keep in the same system that's not getting you any better just because it's subsidized by insurance. Okay, we have to step outside of that box. Now, the great thing for you is that I'm not beholden to any pharmaceutical company. I don't have any pharmaceutical representatives coming into my office saying, give this drug, give that drug, buy me a lunch, and doing this and doing that to get me to give their products. I'm not beholden to any companies in that regard. Not beholden to any insurance company telling me I can't order a test that I think is in the best interest of your health. I am beholden to you. If you hire me as your doctor, I do the absolute best job that I can so that you get better and get your life back. That's the most important thing for me. I can get you better, but if I don't think that I am the best doctor for you, I will not even accept your case, okay? I have on numerous occasions turned patients away because I just don't think that I'm the best doctor for them, or they are not the best fit for our program. In fact, just a couple of weeks ago, we had a patient come into the office and he asked me what could he do to get himself better. He was literally basically on death's doorstep, and I said, at this point, I'm not really the best doctor for you. You need to go do X, Y, Z. I gave him some suggestions, see some other doctors who do these types of things at home to really start improving your health, and I gave him those suggestions because I didn't think I was the best fit for him and he was not the best fit for our office. So I will be very upfront with you and let you know whether or not I think it's a good fit for you and whether or not we think you will benefit from what we can offer you. Okay, patients who come in our office with thyroid symptoms have very similar stories. So what happens is you go to your primary care doctor because you've been experiencing some of the symptoms I talked about earlier. You can't lose weight, so you're doing a diet, you're doing exercise, you're doing all of these things, and I've had patients come in doing CrossFit, which is a very intense workout, and eating really healthy, and they still can't lose weight. In fact, they're gaining weight. So you're doing all these things, you can't lose the weight, you can't sleep, so you're chronically fatigued all the time. You have dry skin and dry scalp, and you're losing a bunch of hair. You comb your hair in the shower, and it's just coming out all over the place. So you have these symptoms, you go to your primary care doctor, the primary care doctor says, well, this sounds like thyroid, because it does, and they order the standard thyroid assessment blood marker, which is TSH, stands for thyroid stimulating hormone. They order it, and what happens is your TSH is really high because your thyroid function is low. So they say, well, you have hypothyroidism, we're going to put you on a medication, a thyroid hormone replacement medication, something like Synthroid or levothyroxine, something like that. And they're going to tell you to come back in a couple of months and they'll recheck you. So you come back in a couple of months and they retest the TSH, and now the TSH is within the normal range. And so the doctor tells you, well, we fixed your thyroid, you're good to go. But you say to the doctor, doctor, I'm still experiencing all these symptoms. I'm having hot flashes, anxiety and depression still going on. My hair's still falling out. I still can't lose weight. I can't sleep. I'm fatigued all the time. I don't want to do anything. You still have all these symptoms, but inside that pharmaceutically driven, insurance driven medical model, as long as your TSH is inside that range, they have nothing else to offer you. And they're going to tell you that it's normal and send you on your way, despite the symptoms. And I've talked to medical doctors about this. There's nothing they can do. If you're inside that TSH, they cannot go outside of that standard of care for medicine. And even if they wanted to, they can't for liability reasons and also issues in regards to insurance coverage. Because it's an insurance pharmaceutically driven model, they can't step outside that box. We can, and we're going to talk to you about how we do that for you. Unfortunately, you're not alone in your suffering. 20 to upwards of 40 million Americans suffer with thyroid-like symptoms. It's much more common in women. In fact, 1 in 8 women at some point in their life will have thyroid-like symptoms. Half of the people go undiagnosed, and so maybe you're watching this video and you have the symptoms, but you never had an official diagnosis. Maybe you've even had it tested and they said, well, it's normal, so they didn't do anything for you. Obviously, you're still suffering from your symptoms. Keep watching. I want to encourage you that if you're sick and tired of being sick and tired, which at the point that most patients get to our office, this is where they are, just sick and tired of being sick and tired. You're definitely in the right place. There's hope for your situation. So there's 2 basic issues that can go on with your thyroid. A lot of things can happen with it, but 2 basic things. Hyperthyroidism, where the thyroid's producing too much thyroid hormone, or hypothyroidism, where the thyroid's not producing enough. And so let's go through some of the symptoms of each of these. With hyperthyroidism, it's basically a speeding up of your metabolism. So you can have things like heart palpitations, inward trembling, nervousness, anxiety, insomnia, hot flashes, night sweats. In this, you actually have difficulty gaining weight. With hypothyroidism, your metabolism slows way down. And so what happens is you have things like fatigue, and it's usually due to the fact that you can't sleep through the night. So you have trouble falling asleep, and then you have difficulty staying asleep. So you wake up, you can't go back to sleep. Cold hands and feet, so you have temperature regulation issues, you're gaining weight, you have bowel disturbances, so you have cramping and bloating and distension and things like that after you eat. You have depression and anxiety. You have lack of motivation, so I hear people tell me all the time, I just don't feel like hanging out with friends anymore, I don't like going out and being with my family anymore. It really has an impact on your quality of life in that way too. You have headaches, thinning hair, losing it in the shower, it's getting real thin, dry skin and scalp, and brain fog, like I mentioned before, as you walk into a room and you're like, what am I doing here? I totally forgot why I came into this room. So you have short-term memory type issues. Let's talk about thyroid metabolism. So this little tiny gland in the base of your neck, how can it have such wide-ranging symptoms? How can we have memory and concentration issues, and skin and hair issues, and headaches, and motivation problems, and emotional concerns, and GI issues, and weight gain, and temperature regulation, and sleep? How can there be so many different areas affected? It's because thyroid hormone is required by every single cell in your body in order to function properly. Brain cells, cells in your little pinky toe, every single one of them needs thyroid hormone in order to function properly. So if you have hypothyroidism, you don't have enough thyroid hormone, so the metabolism of all of those cells goes way down, and you end up with all of these different types of symptoms. And we're going to talk down to the cellular level about how this actually happens in just a couple of minutes. Thyroid metabolism, like I said, is extremely complicated, but let's try to keep it as simple as possible. Basically, your thyroid gland and the thyroid hormone runs your metabolism. It's responsible for your growth, mental, physical, emotional growth, because it's responsible for the buildup and breakdown of proteins, fats, and carbohydrates. It's basically like the gas pedal of your metabolism. Your thyroid gland is a part of the overall endocrine system, and you may not be able to see this very well, but I'm going to talk about the different types of organs that are involved in your endocrine system. It actually starts up in your brain, like I mentioned earlier. The pituitary and the hypothalamus are the 2 organs that are in the brain, but are all part of the endocrine system. So this is our interface of the nervous system and the endocrine system. It's the connection between those 2 systems, and it happens in the brain, which is why we evaluate our patients neurologically, because if we don't look neurologically, we're missing the 2 starting steps to thyroid metabolism. So you've got the pituitary gland, we've got the thyroid is part of it, the adrenal glands, your kidneys, your male and female reproductive glands. The pancreas is involved with blood sugar regulation, which has an impact on things like diabetes, but it also impacts thyroid metabolism. We can have problems in the gut. We're going to talk a lot about the gut and how it has a huge impact on whether or not your thyroid is producing enough thyroid hormone and whether or not it actually gets to your cells. So let's go through and talk about the 10 steps for thyroid metabolism. So what I'm going to do is I'm going to draw out the 10 steps up here. They're kind of listed here, but we're going to talk about them in detail, exactly what's going on. So I would encourage you to actually take out a piece of paper and a pen and write this down, because it's a good reminder of the intricacy of the thyroid metabolism and how it works. And then we'll go back through and talk about what happens when these particular metabolic steps stop working properly. So as I said, this all starts up in your brain in a place called the hypothalamus. The hypothalamus sends signals down to the other part in your brain called the pituitary gland. The pituitary gland then sends signals down to the actual thyroid. The thyroid gland is just like any type of factory. So as you know, factory needs instructions for what it has to build, it needs machinery to build it, and it of course needs the raw materials in order to build those things. So in the thyroid gland, the machinery is called TPO. It stands for thyroid peroxidase enzyme. The raw materials are iodine and tyrosine. The TPO, when it gets instructions and messages from the brain, the hypothalamus and the pituitary, will combine iodine with tyrosine. When it combines 4 iodines with tyrosine, we get T4. When it combines 3 iodines with tyrosine, we get T3. Those are the 2 main thyroid hormone types. What your body needs is T3. T3 is the most metabolically active form of thyroid hormone, so we need lots and lots of T3 in order to actually act on the cells. Problem is, what your body produces is mostly T4. So 93% of everything that's produced in the thyroid gland is in the form of T4. Only 7% is in the form of T3. So this poses a problem. We have all this T4, it doesn't do us any good. We need the T3. So how do we get from one to the other? Other tissues in the body become involved, and they actually do the conversion from T4 to T3. And I'll talk more about that in just a moment. Before we get there, what I want to do is talk about how does the brain know that it needs to signal the thyroid gland to actually start producing more thyroid hormone. The way the brain knows that is because, just like all hormones in your body, thyroid hormone is being monitored by your system at all times. And so when thyroid hormone levels drop, signals get sent up to the pituitary and to the hypothalamus saying, hey, we don't have enough thyroid hormone. And so what happens is the hypothalamus and the pituitary gland, when they get that message that says not enough thyroid hormone, they send signals down to the thyroid saying, hey, make more thyroid hormone because we don't have enough. So those messages are in the form of TRH, which stands for thyrotropin releasing hormone. Let's just say that there are 3 messengers called Tom, Renee, and Harry. Tom, Renee, and Harry, they run down to the pituitary gland and say, hey, pituitary, I need you to send some of your signals down to the thyroid so that we can make more thyroid hormone, because we just got the signal saying there's not enough. So the TSH is the signal that's sent from the pituitary down to the thyroid gland itself. This stands for thyroid stimulating hormone, and this is the gold standard marker for assessment of thyroid function. But as you're going to learn, it's not appropriate to just test the TSH, because there can be other causes of thyroid issues that warrant testing of other different markers, and we'll talk about those. Okay, so now we're back to the thyroid. We're producing thyroid hormone. Remember, I said the problem is that thyroid hormone is produced, 93% of what's produced is in the T4 form, only 7% is T3, so we have to convert it. This conversion takes place in another part of your body called the liver. So now we're introducing another body system into thyroid metabolism. I bet you didn't even realize your liver was involved with thyroid hormone production. Now, before we get there, all hormones, in order to travel in the blood from one place to another, have to have a carrier protein. It's a chaperone. We're going to just represent this basically with a bus. So this is our bus that carries thyroid hormone. We're going to call it the TBG bus. That stands for thyroid binding globulin. And on this bus there's a bunch of seats, and those seats are going to be taken up by thyroid hormone. And just like thyroid hormone needs a bus to go places, so do all hormones in the body. This particular bus takes thyroid hormone, and it'll take it to any place in the body. Right now we want it to go to the liver. So T4 is going to take up most of these seats on the bus because there's more T4 than T3. So now the bus is loaded, it's going to the liver. Once the thyroid hormone gets to the liver, what's going to happen is we're going to start this conversion of T4 over into T3. So 60% of all of the T4 that makes it to the liver gets converted directly into T3, which is great because that's what we need. We need lots of T3. 20% of the T4 gets converted into a molecule called reverse T3, or RT3. Reverse T3 is completely inactive in the body. It does nothing for metabolism, and so eventually it'll get recycled and broken down and can be reused later, but it does nothing for metabolism on the cells. So if you're converting too much T4 to RT3, that can indicate a potential problem. Now, the standard medical insurance-driven model does not test for RT3. We do, because if there's a problem there, we have to figure out why is there so much conversion. We have to address that cause. The other 20% of the T4 is converted directly into T3S and T3AC. Both of those are inactive as well, but only temporarily. We get another system involved in this metabolism, and we take those over to the gut, which is stomach, small intestine, large intestine is your gut. And we have the T3S and the T3AC get converted directly into T3. So now we have 3 different places that are producing T3, the gut, the liver, and the thyroid itself. Now, one key thing I want you to understand is that in order for you to have proper conversion in the liver of T4 to T3, or in the gut from T3S and AC into T3, you have to have a healthy functioning liver, you have to have a healthy functioning gut. Most people that come into my office do not have a healthy functioning liver, do not have a healthy functioning gut, so their metabolism of T4 to T3 is way down. Basically, this process doesn't happen the way it's supposed to because you have these other areas that are involved in thyroid metabolism that aren't working well. So this could be an indication of it's not a problem with your thyroid at all, it's a problem with your liver and or your gut that are involved in your thyroid metabolism, and that's why you have hypothyroid-like symptoms. Maybe it's not a problem with your thyroid at all. You don't know that, though, unless you do proper testing. And the traditional medical, pharmaceutically driven, insurance-driven model doesn't test for these other things. Okay, remember earlier I said that all cells in your body, whether it's a brain cell or a pinky toe cell, they all need thyroid hormone in order to function properly. So we're going to represent this as a cell in your body. It can be any cell, brain cell, pinky toe cell. They all need thyroid hormone. They all need T3 in particular. This little indentation here is called a receptor because it receives thyroid hormone. It only receives thyroid hormone, though, if it's in the correct shape. When it's in the correct shape, it fits in like a lock and key mechanism, and it unlocks the metabolism in the cell, so that what happens is we have a series of chemical reactions that happens. It actually activates all the way down to the DNA level, which initiates metabolism. So here's where thyroid hormone has a direct impact on your metabolism of proteins, carbohydrates, and fats. When it locks into this receptor and activates the DNA, then we have metabolism. So if you don't have enough production of thyroid hormone for whatever reason, your metabolism goes way down. Okay, now there are 10 different steps in this process that we went through. At any point in this process, we can have a malfunction. A malfunction is going to cause a decrease in the production of your thyroid, or the transporter of your thyroid, or the connection of thyroid to the cell receptor, the initiation of metabolism. Any one of these places, because that can have an impact on your quality of life, is what I'm trying to say. Let's go back through and talk about these 10 areas. So the first 2, remember, are in your brain, the hypothalamus and the pituitary gland. So let's just draw this up here so you can see these 2 are in your brain. That's your brain. Okay, your hypothalamus depends upon proper activation by 2 neurotransmitters called dopamine, and serotonin. If you have improper levels of neurotransmitters, in particular dopamine and serotonin, it's going to impact the activation of hypothalamus. If you don't activate the hypothalamus, you're not going to secrete TRH, you're not going to activate the pituitary, you're not going to secrete TSH, your thyroid's not going to get the message, you're not going to make any thyroid hormone, your metabolism's going to go way down, you're going to have lots of symptoms, your quality of life's very poor. That's just one problem area, the hypothalamus. That's not even an issue with the thyroid. Remember, you can have these symptoms and have nothing actually wrong with your thyroid. Dopamine and serotonin are also happy hormones, so if you have dysregulation and improper production of dopamine or serotonin, it can affect your mood, and so maybe that's why you have depression or anxiety in addition to the symptoms that you're experiencing. So assuming we have proper hypothalamic function, we get signals down to the pituitary gland. The pituitary then needs to secrete TSH. You can have problems in your anterior pituitary gland, so you're not secreting thyroid stimulating hormone properly. If you don't secrete TSH on your lab test, TSH is going to go down, not because necessarily you have a problem with the thyroid, but maybe you have a problem with the pituitary. It's just saying, hey, I don't want to make TSH, and it doesn't. So then it seems like you have a thyroid problem, but you really don't. You have a pituitary problem. So why don't we address the actual cause? That's what we try to figure out through extensive testing. What's the underlying cause? Remember I talked about diagnosis. What's the underlying issue that we need to deal with? Okay, you can obviously have an intrinsic, what we call primary hypothyroidism, where you have perhaps an autoimmune disease that's attacking your TPO, your thyroid peroxidase enzyme. It starts to destroy that machinery so that you can't actually make thyroid hormone anymore. You can have an iodine deficiency. This is the #1 cause of hypothyroidism in the entire world, but not in the United States. I'll talk about what the #1 cause in the United States is in just a moment, but iodine deficiency is not it. In fact, if you take iodine, it could sometimes actually make your symptoms worse. You could have a problem with protein amino acid synthesis, which is required to make tyrosine, the other key component, the building block to thyroid hormone. If you have a primary hypothyroidism, an issue right here directly in the thyroid, which some people do, those really are the only ones that are effectively managed by the medication hormone replacement supplements, or the medication hormone replacements, things like levothyroxine and Synthroid, because your thyroid just physically can't make enough hormone because there's an intrinsic problem there. #6 problem could be with the bus, so you can have a problem with the transport mechanism. You make enough hormone, but you can't get it to where you need it to go. You can have a problem here in the liver. This is a big one. If you have any type of liver dysfunction, it's going to have an impact on your conversion of T4 to T3. What can impact liver conversion, aside from any of the number of liver dysfunctions like fatty liver and that? You can also be producing too much of a hormone called cortisol. Cortisol is a stress hormone. Who's not stressed, right? If you have too much of it, it impacts this conversion. I'll talk more about cortisol later. You could have mineral deficiencies, deficiencies of things like zinc and selenium. How do you become minerally deficient? You don't eat the way you're supposed to, or from different types of medications. If you have one of these two things, it could be negatively impacting your liver, and therefore you're not converting T4 to T3 properly. You can have problems in the gut. So what types of problems can you have in the gut? You can have things like leaky gut syndrome. If you've done any research on thyroid disease, you may have come across leaky gut syndrome. You can have what we call, and I'll talk more about that later, you can have something called dysbiosis, where your bacteria levels in your gut are not what they're supposed to be. Yes, you're supposed to have bacteria in there, but maybe you have too much of one and not enough of the other. You could also have an infection, so maybe you have an underlying parasitic infection that you don't know about, and more often than not, we find that people do have these particular issues. Maybe you have food sensitivities. Maybe you're sensitive to things like gluten or dairy or egg or soy products. I'm going to talk more about these later, but any one of these things or all of them can be impacting gut function. You also need an enzyme called intestinal sulfatase to actually make this process work properly. So any problems in the gut are going to hinder the conversion of T3S and AC over to T3. You can also have things like autoimmune conditions that can impact gut function as well. So the gut is huge. I just named 5 different things there that can go wrong with the gut that can impact your thyroid metabolism. You can have problems here at the receptor site. So right at the cell where the lock and key mechanism happens, you can have a problem with that connection there. In particular, hormone irregularities can impact that. If you have too much estrogen, that estrogen can get into that receptor site and you're not going to be able to bind thyroid hormone and you're going to end up with hypothyroid-like symptoms. And a lot of people are actually estrogen dominant and that can be a problem there. I forgot to mention over here on the TBG bus, estrogen plays a role here too, in that it will actually take up these seats. So again, everybody's estrogen dominant for the most part. If you have too much estrogen, you're going to take up those seats on the bus, you're going to block the receptor site, it's going to have a huge impact on thyroid metabolism. I'll talk a little bit more about estrogen later. And then finally, number 10, you can have a problem here at the DNA level, the nuclear level there in the cell, and that can impact metabolism as well. So there are 10 different areas here where you can have problems going on that can impact proper thyroid physiology. If you have one or more of these, it's going to impact the amount of thyroid hormone that's actually able to do the work on your cell. It's going to give you low metabolic function. It's going to give you all of the symptoms that you're experiencing that is being blamed potentially just on the thyroid, but as you can see now, may not even be the thyroid. But the interesting thing is that for 90% of you, for 9 out of 10 Americans with thyroid issues, none of this stuff even really matters. And the reason why is because for 9 out of 10 people in the United States, the number one cause of thyroid disease is not one of these things, but it's an autoimmune condition called Hashimoto's disease or autoimmune Hashimoto's thyroiditis. This was discovered in 1912 by Dr. Hashimoto, and basically what's happening is your immune system is attacking your thyroid gland. Now your immune system is supposed to attack viruses and bacteria and parasites and protect you from these invaders. But what happens is sometimes it gets confused, your immune system gets confused and disorganized and in disarray, and it starts to attack your own self-tissues, things like your thyroid. And in this particular case, that's what's happening. Let me talk to you a little bit about your immune system. There's two different parts to your immune system. You have Th1 and Th2. Let's think about Th1 as kind of the Pac-Man of your immune system. So you remember Pac-Man, that video game? Okay, he's going around, he's eating all those little dots. That's essentially what the Th1 system does. It is white blood cells, macrophages. They go and they destroy things like bacteria, viruses, and parasites. How do they know what is a virus or what is a bacteria, what is a parasite that needs to be destroyed? Well, the Th2 is what tells them that. Th2 is the flag man. It puts a flag on all of the things that are not supposed to be in your system. So Th2 will go and put a flag on a virus. It'll put a flag on a bacteria. It'll put a flag on a parasite. And that will indicate to your Th1, the Pac-Man, that, hey, I need to go destroy that. What happens is when this becomes unbalanced and Th1 just starts destroying whatever it wants to, viruses, bacteria, thyroid gland, or when Th2 gets out of balance and starts putting flags on things that it's not supposed to, virus, bacteria, thyroid gland. And this is what can initiate an autoimmune attack on your thyroid when your immune system becomes out of balance. And Th1 starts to destroy things like your thyroid, or Th2 starts to flag things like it's not supposed to, like your thyroid, and then Th1 comes and destroys it. This is really important and intimately connected to your gut health because 60 to 80% of all of your immune system is in your gut. So if you have a problem with your gut, that can initiate an autoimmune attack on your thyroid. Remember the 5 different things I talked about in regard to the gut issues? You can have an autoimmune issue, you can have a leaky gut, dysbiosis, infection, food sensitivities. All of these things, in addition to a couple others that we'll talk about later, can initiate this autoimmune attack on your thyroid. One thing I ask my patients is to consider is this. If 9 out of 10 of you have autoimmune Hashimoto's and 60% of your immune system is in your gut, have you had your gut evaluated in the evaluation of your thyroid symptoms? If not, it's kind of crazy because 80% of what's going on for 90% of you is right in your gut and they don't even look at it. We have to step outside of that pharmaceutically driven insurance model and start to look outside that box to find the exact underlying cause. And that's what we do with proper testing, and I'll talk more about the gut testing we do later. Okay, now that traditional approach that I talked about for Hashimoto's is the same regardless of what the cause of your thyroid disease is. In fact, most people don't even know they have Hashimoto's because it's rarely, if ever, tested for. And the reason why is because even if you come back positive for the antibodies to your thyroid, it's not going to change the treatment approach. It doesn't change that medical model. The standard of care doesn't change based on the pharmaceutical insurance company guidelines, even if you have Hashimoto's. Now, I'm not against medications. I'm not telling you to stop your medications. I would never tell a patient to stop their medications. We can work with your prescribing provider. If your goal is to get off of medications, you'd have to work with them, and we can do that in concert with you. But that typical process of just prescribing a medication, trying to keep you inside that range of TSH is not getting you any better. It's not addressing the autoimmune component that 90% of you have. And that's why you're not getting your symptoms resolved. If you want different results, you have to take a different approach. You can't do the same thing over and over again and expect different results. That, as Einstein said, is literally insanity. We've had patients coming in here on Thyroid for literally 40 plus years and they're still not better, but they are expecting different results. Even in staying on the medication, it's not going to happen. You have to try something different. Unfortunately, you have to come outside of that box, which means we're stepping outside of that pharmaceutical insurance-driven model, and that does require an investment on your part, not only in money, but also in time, and we'll talk more about that as we go through. Okay, so there's a lot of different potential causes to thyroid symptoms that you're experiencing. We talked about the 10 different steps here and what can happen. We talked about the Hashimoto's, which 9 out of 10 people have. You can have multiple of these. You can have autoimmune, you can have some of these, you can have a mixed bag, and that's why it's important that we do proper testing. So we have to connect the dots. We have to figure out which of these is the case for you, for your symptoms, and address those properly. How do we do that? We do that through proper and extensive testing to determine the exact underlying causes of the issues you're experiencing. We're going to go through in the next few minutes what some of the tests are that we might order. When we get test results back, our goal is to support optimal function of the underlying systems in your body. So if we find that your adrenal glands aren't working well, or your liver's not functioning well, or your gut's not functioning well, we're going to prescribe you dietary, lifestyle, and nutritional supplements to properly support optimal function of those particular areas based on your specific testing. Okay, so our goal is to connect the dots because it's not being done for you. Let me give you an example of that. So this is the chart that I looked at earlier. Let me just kind of go through the typical patient that might come into our office. So let's say that your thyroid is being managed by your primary care doctor. So that's your doctor number one. A lot of patients also have heart issues, so they're seeing a cardiologist as well, doctor number two. Patients have kidney issues, so you're seeing a nephrologist, doctor number three. You have maybe some hormonal irregularities, so you're seeing an OBGYN maybe for that, doctor number four. You've got diabetes on top of your thyroid disease, so you're seeing an endocrinologist who's managing that for you, so that's doctor number five. You might have some gastrointestinal symptoms, so you're seeing a GI doctor, doctor number six. You've got some anxiety and depression, maybe you're seeing a psychiatrist. You've got some neurological symptoms. So now you're up to 8 different doctors. Potentially nobody's even talking to one another. So what's happening is none of the dots are being connected. No one is working with anyone else to figure out how these things are interacting. How did the body systems get divided up the way they did? They got divided up so that people like me could study them more easily. But the body does not work in isolation. The different systems in the body don't work by themselves. They work together with all the other systems in the body. The body acts as a whole unit, and that's how we address you. We connect the dots. We look at you holistically as a whole person and see how all the different pieces are interacting with one another. That's really important to get the best possible results. Now, when we look at lab tests, what we do is we look at laboratory reference ranges. Those are the reference ranges that you literally get back printed on the sheet of paper from the lab. So this is an example of labs that were received from a patient of ours, and he actually came in for diabetes, but I want to use him as an example because he also had his TSH tested, which is the standard for thyroid function assessment in the traditional medical model. Let me go through his diabetes numbers real quick. Interestingly, diabetes, type 2 diabetes is reversible. I don't know if you knew that or not, but it is reversible. Let me give you an example. This particular patient, we looked at his hemoglobin A1C. That's the marker for diabetes. And his hemoglobin A1C, when he first came into us, was 6.7. That is above the cutoff for classification or diagnosis of diabetes. So he had diabetes when he came to our office. Working with us for just a couple of months, we got his A1C down below 5.6, and 5.6 is the cutoff for being normal, not even having pre-diabetes, nothing at all, completely healthy. And so within just a couple of months, we reversed his diabetes. Things like his blood sugars went from 155 to 96. Triglycerides came way down from 222 to 56. His HDL improved. His LDL went down, the bad cholesterol. So all of his numbers improved. And again, the reason why I showed you him is not only to tell you that diabetes is reversible, but also to talk about the thyroid stimulating hormone and the reference ranges that are used. So there's a difference between the labs ranges and what we use to evaluate our patients. So the labs ranges are different, first of all, from one lab to the next. The reason why is because they base those ranges off of the population of people that went to that lab the prior year. So let me ask you a question. What type of people go to the lab most frequently? Usually sick people, not healthy people. So those lab ranges are based on mostly a group of sick people. Now, when comparing myself to, when evaluating myself or my family for health, I want to compare us to optimal, healthy functioning people, not a group of sick people. So we don't use the laboratory reference ranges. We use what we call functional or optimal ranges, which are more narrow and allow us to see things coming down the road before they become full-blown issues so that we can address them proactively and not wait until basically you're over the health cliff and falling down into a disease state. Okay, so like I said, it's different from lab to lab. I'm going to use this example of a local hospital. Their lab range for TSH is anywhere between 0.4 and 4.5. If you're inside that range, you are going to be considered healthy and normal for your thyroid function. They're not going to do anything for you. If you're at 4.6, that's the magic number. Now you have hypothyroidism, they're going to put you on a medication. If you're at 0.3, you have hyperthyroidism, now they're going to do something and intervene there. But if you're at 0.5, that's not good enough to have any help. If you're at 4.4, they're not going to do anything for you because that's outside of the standard of care. The insurance pharmaceutically driven model does not allow for anything to happen even if it's that close to a disease state. So nothing gets done and then they just basically wait until you get over into 4.6 or you get to 0.3 and you've got a full-blown issue. Then they start to address the problem. What we do is we narrow down the range, and these ranges are based on healthy, optimally functioning people. Some of them are defined by the Endocrine Society. And for thyroid, it can be anywhere from 1.8 to 3.0, and sometimes that shifts a little bit, but we want to see it narrower than the standard, the range for the laboratory. So what happens is, if you're in this range, 0.5, I'm going to say, well, you're trending towards hyperthyroidism, and we need to do something about that. If you're right here at 4.4, I'm going to say you're trending towards hypothyroidism. We need to start working on that. Think about it like this. If you're walking towards a cliff with your eyes closed or blindfolded, when do you want to know that that cliff is there? After you tumble over the cliff or before you get there? Now, of course you want to know before you get there, so that you can prevent it from being an issue. Same thing with your health. You want to know before you tumble over that health cliff, before you tumble over that thyroid cliff, that you're heading towards it so that you can take proactive measures. That's what these functional lab values allow us to do for our patients. Okay, but if you're in that green zone there, your doctor is going to basically say that you're normal and they're not going to have anything to offer you inside that box. You have to step outside that box that's driven by the pharmaceutical companies and the insurance companies to actually grab a hold of your own health and take control of it and be proactive in addressing these issues. Okay, so what are the different panels that we order? We order an extremely comprehensive blood panel that has about 60 to 70 different markers depending upon the person, but we do a full thyroid panel. That thyroid panel is going to include things like antibodies. Remember I talked about the fact that 90% of people in the United States have an autoimmune attack where your immune system is attacking your thyroid. But it's rarely, if ever, checked because it does not change the standard of care in the medical model. It will change our approach, so we test for it. There's a bunch of other different tests that we look at. We look at T4 and T3. Did you know there's two forms of T4 and T3? Total T4 and T3 and free T4 and T3. The free ones are the most important ones because those are the ones that are off the bus, able to actually work at the cellular level and drive metabolism. We test things like reverse T3 and T3 uptake. These are all extremely important in determining the exact underlying cause of your thyroid issue. So we do a full thyroid panel, we do a lipid panel, so we're looking at good and bad cholesterol and triglycerides. We're going to be doing a CBC with differential, so we're looking at red blood cells and white blood cells. Red blood cells let us know whether you have an anemia. If you have an anemia, you're not getting enough oxygen to your tissues. So it doesn't matter what else we do to address your problem. If we don't make sure you're getting enough oxygen to your tissues, your cells are not going to work properly. So we have to address anemias as a top priority. White blood cells give us an indication of how your immune system's functioning and whether or not it's fighting off a bacterial or viral or parasitic infection at the moment. We look at electrolyte markers, which tell us how the liver and the kidneys and the adrenal glands are functioning. We look at vitamin D because it is actually not a vitamin, it's a hormone, and it's an indicator for overall health. And almost always we find with our chronically ill patients, vitamin D levels are way low, so we may need to supplement for that. And then we look at inflammatory markers. Inflammation is the key driver to all chronic diseases. Thyroid disease, diabetes, fibromyalgia, chronic pain, all of these things are driven by inflammation. So we need to look at inflammatory markers, things like homocysteine, C-reactive protein, ferritin, uric acid. When we find these are high, then we know you have underlying inflammation, which is basically like having an underlying infection all the time. We have to figure out what are the triggers for the inflammation. We have to get rid of those, and that's what we need to do. If you have high homocysteine, it may indicate that you also have a particular type of genetic defect, which we also test for, and I'll talk about that here in just a couple of minutes. We also test for autoimmunity. So not only autoimmunity to your thyroid, but if we find that you may potentially have other autoimmune diseases, we can test different tissue types like bone and heart and brain and collagen, muscle, to see if your immune system is actually attacking those types of tissues. You know, you can have those positive antibodies for those other tissue types up to 10 years before they even cause any symptoms. So we can find out way ahead of time if something else is going on underlying and then address it, again, before you get to that particular cliff and have a full-blown issue. A lot of times patients will have more than one autoimmune disease. So this is what we call being polyautoimmune. If you have one autoimmune disease, which Hashimoto's or thyroid autoimmune would count as one, which 90% of you have, then you're 50% more likely to have 2 or more autoimmune diseases. Things like rheumatoid arthritis that destroys your joints, or multiple sclerosis, which is a neurological autoimmune disease where your immune system is actually attacking the myelin sheath of your nerves. The myelin sheath is a fatty wrapping around your neurons, your brain cells. It helps to insulate them and it helps them to conduct their messages efficiently. What happens is that starts to break down and then your messages don't get conducted properly. Hashimoto's is thyroid, obviously. Sjogren's, IBS is a bowel issue. Lupus is another autoimmune disease. Psoriasis is when your immune system is actually attacking your skin cells. So you have red, itchy, flaky, dry, irritated skin. In particular, it starts usually on the backs of your arms. Once you have one of these issues, you can have more than one, most likely, because your immune system is just in disarray. It's disorganized and confused, and it's attacking self-tissue instead of focusing on foreign invaders like viruses, bacteria, parasites, and things like that. Okay, so what can cause an autoimmune disease, whether it's Hashimoto's or MS or any of these other things? A lot of gut issues can trigger autoimmune because most of your immune system is in there. We'll talk about that in just a minute. But also hormonal irregularities can trigger autoimmune diseases. Let me talk about ladies as an example here just for a moment. So a lot of times what will happen is, let me give you just a story. A girl, let's say she's 14 years old maybe, and she's transitioning from middle school or junior high over to high school. She's doing really well in school, getting great grades, and then about halfway through freshman year, now all of a sudden she's doing really poorly in school, and mom and dad can't figure out why. And maybe they're thinking, well, she's just interested in boys, she's not paying attention to schoolwork as a priority anymore. Well, she may be interested in boys, but there may be something a little more serious going on. And what's happening is during puberty, hormones start to fluctuate. That hormonal fluctuation can trigger an autoimmune disease. Autoimmune disease causes chronic inflammation. Inflammation when it gets to the brain, in particular the hippocampus of your brain, which is responsible for learning and memory and conversion of short to long-term memory, that starts to get destroyed by that inflammation. And now she can't remember things to do well in the tests, so her grades go down. So yeah, she might be interested in boys, but she may have an underlying autoimmune disease that gets triggered because of the hormonal fluctuations. Second time this happens is during pregnancy. I have a lot of patients that come in and I read their stories, and basically what they're telling me is that after my first kid I was fine. I lost the baby weight, didn't have any issues with depression, things went really well. Baby number 2, that was it. Postpartum depression, couldn't lose the weight, fatigue, insomnia, chronic pain, all these symptoms, and they just never went away after that second kid. That's because during pregnancy we have hormonal fluctuations that are going on that can trigger an autoimmune disease. Third time this happens is during menopause. During menopause, the production of hormones like progesterone and estrogen switches from the female reproductive organs over to your adrenal glands. Now, I haven't talked about the adrenal glands yet, but what they do is they normally are your stress glands. They produce cortisol, and what happens is they tend to get fatigued over a lifetime. So 60 years of stress on the adrenal glands, now your body needs them to produce estrogen and progesterone, and the adrenal glands are saying, no way, we're not doing that. So now your hormones are all messed up, and that can trigger an autoimmune issue as well. So 3 different times that can happen with hormonal changes. One of the things that I mentioned before is that estrogen, another problem with the hormones, can take up seats on the bus, but it can also block receptor sites on the cells. So that's another way that it can impact thyroid metabolism. So we have to address the immune system. The immune system, for 9 out of 10 of you, is the underlying cause of the thyroid issues. It's not being addressed in the traditional medical model driven by the pharmaceutical companies and the insurance companies inside that box. They don't address the immune system, not at all. We have to step outside that box, figure out what the underlying cause is. Most of you have an immune issue. That's what we need to address. Okay, food sensitivities, I also mentioned, can impact the gut, impact the immune system, because 80% of your immune system potentially is in your gut. Now, there's a distinct difference between food sensitivities and food allergies. Let me give you an example. Food allergy is like, for example, having a peanut allergy. One of my team members has a peanut allergy, and what happens is if she eats peanuts, her throat swells up, she gets itchy, she can't breathe, and it becomes a very serious life-threatening situation. She either has to use an EpiPen or we have to take her to the hospital, or both immediately, because it can be life-threatening. That's a food allergy, immediate life-threatening problem. Food sensitivity, it can have a huge impact on your quality of life, but it's not as immediately life-threatening as a food allergy. So you have to understand the difference. You may have been tested for food allergies, you probably have not been tested for food sensitivities. Things that you can be sensitive to most commonly are items like gluten, dairy, egg, and soy. Those are the ones we test for most commonly. What happens is when you eat these different foods, they confuse your immune system. So if you're sensitive to gluten, what happens is, remember that Th1, Th2 story? If gluten gets into your bloodstream, and I'll talk in a couple of minutes how that can happen, but if gluten gets into your bloodstream, what happens is your Th2, your flag man of your immune system, he's putting flags on all the things that are not supposed to be there. And if you're sensitive to gluten, he's going to put a flag on your gluten. And then Th1 says, oh, that's not supposed to be there, it's got a flag, I'm going to destroy that. Unfortunately, sometimes your thyroid gland gets confused for gluten by the Th2 system. So what happens is the Th2 puts a flag on gluten, flag on gluten, flag on gluten. Oh, look, that's thyroid, but it looks like gluten. I'm going to put a flag there. Now Th1 comes and says, oh, that's a flag, and I just eat what has flags on it, so it destroys your thyroid. That initiates an autoimmune issue. So we have to find out what the food sensitivities are and remove them. There's multiple ways we can do that. We can test for food sensitivities with serum antibodies, blood antibodies. We can do different types of dietary elimination, provocation type situations, but we determine what's best for you once you come into the office. My question is, since 90% of you have Hashimoto's and food sensitivities can cause this, have you been tested? Very, very rarely do people come in having already had the food testing done for sensitivities. Not food allergies, food sensitivities. It's important to make that distinction. Okay, we also do a gut health panel. This gut health panel is done with a stool sample. 60 to 80% of your immune system's right there. 90% of you have an immune issue, so we have to test the gut for potential infections. Maybe you have an abnormal bacterial levels. That's a dysbiosis. Maybe you have an underlying parasitic infection or yeast overgrowth. We have to determine what these things are so they can be addressed properly so we can heal the gut so it's not impacting your immune system, causing chronic inflammation, and basically being like an underlying infection everywhere all the time, impacting your health. We also test for H. pylori. So H. pylori can cause things like stomach ulcers more seriously, but less seriously, a lot of that people that have the acid reflux or the GERD symptoms are caused by H. pylori, so we need to identify that as well. And you can have weird things like tapeworms and roundworms and trichinella. Things you might not think of are common in the United States. We find them. In fact, I just looked at one recently that had an entamoeba species come back on the report. So some really crazy stuff you can find in there, but it's not being tested for in the traditional medical model. Okay, we're also looking for intestinal permeability. This is where the leaky gut situation comes into effect. So leaky gut is basically where the lining of your gut, the endothelial, those cells in that lining are becoming damaged, and the integrity of that barrier really from where your food is being digested to your bloodstream in the inside of your body, that barrier is breaking down, and things that are not supposed to get in are starting to get in. Remember, 90% of you have Hashimoto's, so if you have leaky gut syndrome and things are getting through your gut lining into your immune system, into your bloodstream, and your immune system is going haywire, it's going to have a huge impact on your autoimmune situation. Okay, so let's go through an animation here of what's going on with your small intestine and how the leaky gut syndrome plays a role in this. So this is your intestine. Basically, your intestine is a long tube. Your GI tract is a long tube. It starts from your mouth, goes all the way through, and out the other end. Okay? We're just cutting this tube in half here, and now we're going to zoom in to the wall here where this corrugated edge is. Zooming in there, now we have these blue guys here with the little funny finger-like projections. That's the cells that form the barrier of your GI tract. This red area here, these are your red blood cells. This is your bloodstream. Your food comes in right here. We'll get to that in a minute. But basically what's happening is what's preventing undigested food particles and viruses and bacteria, all the stuff that gets in your gut from getting across that barrier are two different types of junctions. One is called tight junctions. The other one is called adherens junctions. And those hold those cells tight so that nothing can get in between those cells. That has to be digested properly first. So here's what that looks like. We've got things like fats, carbohydrates, and proteins that you're eating. They're really big molecules. They need to be broken down before they can get through. So these big molecules are going to be rejected from coming in through that barrier until they get broken down. So here we can see these are being broken down into smaller pieces. Then they can cross the barrier into the bloodstream and be used for nutrition. That's normal barrier function. What happens is, over our lifetime, we expose our gut to things that it shouldn't be exposed to, foods that we shouldn't eat. Coffee, fast food, genetically modified foods, different types of medications, NSAIDs that are a particular type of medications used for a lot of pain. Heavy metal toxicity, so maybe you have some fillings in your mouth that can be causing a burden of heavy metals on your system that can be impacting your symptoms. Eating things that you're sensitive to, like wheat, which is where gluten is found. Corticosteroids, stress, and this can be physiological stress, and also mental emotional stress can have an impact here on the gut lining. Different types of oils, sodas, food additives, and preservatives have a huge impact. Now what happens with these things is they start to break down this lining. The breakdown of that lining creates openings in between these cells. Now they're not connected together, and these food particles and even more serious things like gluten, which is a protein, can get through this barrier. What happens is now this protein gluten gets into the barrier. That's not supposed to be there. So your immune system says, hey, that's gluten. It's not supposed to be here. And so it sends out the Th1 guys, latches onto that gluten, destroys it. So we ramp up an inflamed autoimmune situation. Viruses, bacteria, different types of toxins can now also make their way through the barrier into the bloodstream, activating an immune response. We have this chronically inflamed immune system causing all kinds of problems. Okay, let's talk about your adrenal glands. In my opinion, the adrenal glands are the most overlooked gland in conventional medicine. They are essentially your stress glands. They regulate your sleep-wake cycle. So what happens is maybe you're having insomnia. You can't fall asleep, you can't stay asleep. And maybe you've realized that your adrenal glands are involved in this, so you asked your doctor to test your adrenal glands. Most likely they won't test it for you, but if you get them to do the test for you, here's what's going to happen. They're going to have you come into the office, and they're going to run the test. And let's say they have you come in at 11 in the morning for a blood draw. They're going to draw your blood. They're going to be looking for a particular marker called cortisol. Cortisol is a stress hormone. Cortisol should be high in the morning and low in the afternoon. Remember I said it had an impact here on liver conversion of T4 to T3. So it plays a huge role, and that's why we test for it. But in any case, so let's say you convince your doctor to order the test for you, and the doctor says, okay, well, let's order the test. You get your blood drawn at 11 a.m., and the doctor says, well, it's right where it needs to be at 11 o'clock because that's what it should look like throughout the day. It should start high and should end low. What's the problem with this test? The problem is that anytime you're looking at a hormone that has a fluctuating rhythm over a period of time, you should check that particular hormone over that period of time to see what the rhythm actually looks like. So if we actually tested this 4 times throughout the day, maybe at 7 in the morning it's down here, and 4 in the afternoon it's here, and 10 o'clock at night it's up here. So your graph and your rhythm looks like that, not like that, and that has a huge impact on your ability to sleep. If your cortisol, which is your stress hormone, is way up at 10 o'clock at night, there is no way you're going to sleep. Unfortunately, in the pharmaceutically driven, insurance-driven medical model, if you have sleep issues, they're going to put you on a medication like Lunesta or Ambien. Lunesta, you've probably seen those butterfly commercials, has really terrible side effects. People have been known to get up in the middle of the night and do things technically while they're sleeping, and then they don't remember them in the morning. Things like cooking meals, so you're using sharp knives and fire at your stove, putting you and yourself and others in danger, and people have also been known to get into cars and drive. So rather than addressing the cause of the issue, they're giving you medication that masks the side effects. Why don't we forget about the medication that has the side effects, address the underlying cause of the actual sleep issues, and then we can avoid those potential side effects altogether. Again, we want to address the underlying causes of the issue. So we do this test, an adrenal profile test. Okay, like I said, your adrenal glands are your stress glands. They secrete the hormone called cortisol. If you have too much cortisol, as I said previously, it has an impact on the conversion in the liver. Stress that can impact your adrenal glands is not just mental emotional stress, which we all have, but it can be things like chronic pain. It can be things like blood sugar dysregulation, insulin resistance, diabetes can have an impact on stress, physiological stress, gut issues like a leaky gut, dysbiosis, infection, food sensitivities. This can all drive up cortisol production, having an impact on your cortisol profile throughout the day. So it's important that we test that. Cortisol, when in high levels, also impacts your hippocampus. Remember I talked about the hippocampus earlier when talking about triggers for autoimmune diseases. Okay, the hippocampus is responsible for conversion of short to long-term memory. So if you're chronically stressed and your cortisol is bathing your hippocampus, maybe this is why you're having the brain fog issues. You can't remember things because your stress is causing that inflammation, that cortisol right there on the hippocampus, and you can't remember short to long-term memory anymore because of that impact. And what's happening is they've done studies on pregnant women. They had 2 groups. Pregnant women, group number 1 is pregnant women that had high cortisol levels. Cortisol levels in group number 2 were normal, so high and normal levels of cortisol. They followed these women not only through the pregnancies, but they followed up with the children at age 7. What they found is that the women that had the high cortisol levels had children that were much more likely to have what? You already know it. Learning and memory issues, things like ADHD. This has a huge impact on the developing baby's brain during pregnancy when the mom is stressed out, because that cortisol bathes that brain during critical fetal development, and then they have learning and memory issues later on. And that ends up with things like ADHD. So it can affect us as adults too. Okay, so we're looking at hormones. I talked a lot about estrogen already, hormonal fluctuations causing autoimmune issues, estrogen taking up seats on the bus and impacting cellular receptors. But estrogen can also come from your environment in the form of what we call a xenoestrogen. Xenoestrogens can have the same impact on your thyroid metabolism. They can also impact other types of metabolism. As I said before, a lot of us are estrogen dominant simply because we basically live in a sea of estrogen. There's estrogen all around us from a lot of the chemicals that we're exposed to. Let me give you an example. You've probably heard of BPA before. If you bought a plastic bottle like this at a local store like Target, you may have seen a label on there that says BPA free. BPA stands for bisphenol A. It is what we call a xenoestrogen or a xenobiotic. It has a huge impact on your metabolism. It's been known to cause things like cancer and neurological deficits, diabetes, obesity, so they've taken that out of the plastics. What happens is heat activates the chemicals and they leach into the contents of the container. So if you're getting a disposable water bottle at a convenience store and letting that bounce around the back of your car for a long time, and then you take a drink out of it and you're like, oh man, that tastes like plastic. Yeah, of course it does, because those plastic chemicals have leached out into the containers, the contents of the container, and now you're consuming those. These things are everywhere, okay? Our job is to reduce our exposure as much as possible. Here's another thing that you can do at home. Instead of microwaving things in plastic, and causing heat to activate those chemicals to leach out, use ceramic dishes or glass bowls, cover them with paper towels so you don't have that plastic getting into the contents of your food. Let me talk about something else. You may have seen these pans sitting here on the table. So any non-stick type of pan is going to have a coating of Teflon or some other type of chemical that creates that non-stick surface. What happens is, after being exposed to the heat and also the mechanical friction there of all of your cooking utensils, that starts to wear off. And so you can see, you may not be able to see, but look at your own pots and pans. You'll see that the streaks and the damage, the marks on the pan, indicating where that chemicals have come off. Now, where does that chemicals go on? They've gone into your food. Those are xenobiotics. They have a huge impact on your body's metabolism. You really need to stop using things like this, and this is an example of me applying this in my own life. We don't use this at our home anymore. I have this in the office here so I can show patients and talk to them about how you need to stop using these types of things to reduce your exposure to these chemicals. Okay, so we do test for hormones. We run male and female hormone panels on both male and females because we all have testosterone, we all have estrogen, we all have progesterone. Just should be in different amounts, and for females should be in different amounts at different times, not only in the month but also in your life. So a lot of us, like I said, are estrogen dominant. If you have too much estrogen, you're going to produce more fat tissue. When you have more fat tissue, you produce more estrogen, which causes you to produce more fat tissue. And this becomes a vicious cycle, and that's contributing to your inability to lose weight. In women in particular, estrogen is the gas pedal, progesterone is the brake pedal. When we have an imbalance of these hormones, which commonly happens in menopause, that can cause a lot of the symptoms that you're experiencing. Remember, we talked about the fact that at menopause, the production of estrogen and progesterone shifts from your female reproductive organs over to your adrenal glands. But remember, your adrenal glands are exhausted after 55, 60 years, and they want no parts of producing any of these additional hormones because they're fatigued. So we have now a hormonal imbalance because your reproductive organs aren't producing them anymore now that you're in menopause, and the adrenal glands aren't helping anymore either. In men, same story. Increased estrogen causes increased fat deposition. Insulin resistance can lead to prostate hypertrophy, so you can't urinate properly anymore. A lot of people, they just want to blame these things on getting old. Well, I'm getting old and my prostate's enlarged, you can't go to the bathroom anymore. That's just what's supposed to happen. Or, you know, I'm going through menopause and I'm supposed to have hot flashes and this is normal. It is not normal. It is common. There is a huge difference between common and normal. It's very common to have these things because we just, as a society, don't take care of ourselves the way that we should. It should not be a normal part of the aging process to have all these issues, but a lot of people want to blame these issues on getting older. So we do the testing, and we test a particular type of hormone. We test the free fraction hormone. This is the ones that are freely available to do work on the cell, like the free T3 that I talked about, or free testosterone, or free estrogen, or free progesterone. It's important you test a free fraction hormone because the ones that are on the buses, they can't do any work for the cell. Unfortunately, this is what's tested most often, and it's not a very good indicator of proper function. Okay, I talked earlier about inflammatory markers, in particular homocysteine. If you have a high homocysteine, it could indicate a genetic defect. A lot of people have this particular genetic defect that I'm going to talk about, and they don't even know it. In fact, I have this particular genetic defect myself. I tested myself, and now I'm applying the therapeutic protocols to myself as well once we found this particular test to be positive. So what's happening is, this is a gene called MTHFR. It stands for methylene tetrahydrofolate reductase. Big, long, fancy word, just abbreviate MTHFR. It's responsible for a particular process in your body called methylation. What happens with methylation is you have a big molecule here, and it needs to do work inside your body. But in order for that particular molecule to do work, it needs to be methylated. Basically, we have to add a methyl group. A methyl group is a carbon with 4 hydrogens. So you have to add on the methyl group in order for this particular molecule to be able to do its job. When you have this gene defect, you cannot methylate. You can't add the methyl group onto the molecule, so it can't do its biochemical job. This methylation defect has an impact on 250 to 300 different biochemical processes. So all these different systems in your body start to have decreased function because your genes won't allow you to actually do this methylation process properly. So one of the things is you get an increase in homocysteine due to this, but it leads to a lot of other different types of symptoms. So what is involved in methylation? This is actually just a short list, but methylation is important for production of DNA and RNA, turning on and off genes. It's responsible for brain chemical production. Things like dopamine and serotonin that I talked about are responsible for proper hypothalamic activation. It's responsible for hormonal breakdown. So estrogen, testosterone, progesterone levels can be impacted by this gene. We just talked about how important they are. It can impact the production of immune cells. So immune system is intimately related with thyroid. We talked about that. It's responsible for the protective coating on your nerves. Remember I talked about MS is the destruction of that myelin sheath. That myelin sheath is produced when you have proper methylation. It's responsible for the processing of chemicals and toxins and getting them out of your body. Natural detoxification in things like your liver, it relies upon methylation. When you don't do these things and others properly because you're not methylating things properly, it can cause a whole lot of different symptoms. There's a whole lot of different things that can happen. I have the ones that are commonly associated with thyroid disease highlighted here in yellow. Things like anxiety and depression, peripheral neuropathy, migraines, headaches, hormonal regulation issues, autoimmune disorders, fibromyalgia, chronic fatigue, insomnia, ADHD, focus and attention type problems. All these things can be related to having a defective gene. So we need to test for this. So when you come in to get evaluated at your initial evaluation, I may recommend that we order this test. The test is $99. That's extremely affordable in comparison to the full retail price for most genetic tests is in the thousands of dollars. So we most commonly will recommend ordering this test at your initial evaluation so that we can have this information to give you proper recommendations going forward. What's the point of doing a test unless I can help you with the results? We can help you with a particular protocol to make up for the deficiencies that your genes are dealing with. So I can't fix your genes, I'm not claiming to be able to do that, but we can make up for the deficiencies that result from those mutated genes. Okay, so let's talk briefly about the neurological aspect of our care. Brain-based therapies and neurofeedback is what we do from a neurological aspect. Remember, the first two steps of thyroid metabolism happen in your brain, so if we don't address you neurologically, we're missing a huge piece of the puzzle. So we do what we call brain-based therapies. When you come into the office and we do an evaluation or do a consultation, I'm not just going to sit down and talk with you, but I will do that. I'm going to do what we call a functional neurological exam. We're determining how is each part of your nervous system functioning, from the receptors in your fingers and your toes to your peripheral nerves, to your spinal cord, to your cerebellum, to your cortex. How are all of those different areas functioning or not? Okay, your brain needs three things in order to be healthy. It needs to be given proper food, it needs to be given proper amounts of oxygen, and it needs to be activated or stimulated by our environment. So we address all three of these components in the care of all of our patients. What I'm assessing for primarily in the functional exam is to see whether or not your brain is being activated properly. What we find is that a lot of times patients will have one side of the brain that's not functioning as well as the other side. Let me give you an example. So for kids with ADHD, and we help a lot of kids with ADHD, they have a right brain that's not functioning at the same level as their left brain. Sometimes it's opposite, but a majority we see right brain deficiencies. So we give them brain-based exercises that are designed to stimulate their right brain. So for example, we would have them sit on the right side of their classroom so that all the visual and auditory stimulation is coming at them from their left side, which neurologically crosses over and stimulates their right brain. Sometimes they'll also have a deficient left cerebellum. It's the back part of your brain is responsible for coordination of movements and balance and eye movements and things like that. When they have a right brain issue, a lot of times people have a left cerebellum problem. So we can do therapies that stimulate specifically the left cerebellum. So for example, vibration therapy is known neurologically to stimulate the cerebellum. So we could do vibration just on one side of the body, the left side. We know neurologically that'll stimulate the left cerebellum. That provides the proper activation or stimulation that the brain needs to be healthy and thrive. Some other things that we can do, proprioception. So that's activation of the mechanoreceptors, the muscles, spindles, the Golgi tendon organs in your musculoskeletal system that also activates your cerebellum and your brain. So we could have you do funky movements here on the left side of your body. That's going to stimulate those mechanoreceptors in your joints and your muscles and your tendons and your ligaments. It's going to stimulate your left cerebellum. It's going to cross over. It's also going to stimulate your right brain. Those are examples of brain-based therapies that we have you do both at the office and at home to help stimulate those particular areas of your brain. And of course, we're going to do work on making sure you have enough oxygen and then working on proper diet and nutrition as well. Okay, so we also do what we call exercise with oxygen therapy in our office. This is a book that was written by a medical doctor. It's called Stop Aging or Slow the Process, Exercise with Oxygen Therapy. Basically what happens is every year after age 20, your ability to utilize oxygen at the cellular level here decreases 1% per year. So if you're age 40, you're down 20%. If you're age 60, you're down 40%. Exercise with oxygen therapy has been shown to improve your ability to utilize oxygen appropriately. That's important for brain. Remember, your brain needs 3 things to function. Oxygen is one of them. So in addition to addressing anemias like I talked about earlier, we also address proper utilization of the oxygen at the cellular level with exercise with oxygen therapy. We also do low-level laser therapy on patients that have thyroid issues. So for example, this is a study that was done last year, and it talks about 2 different groups of autoimmune patients that they looked at. So all these patients they looked at had Hashimoto's. One group they didn't give any laser therapy, the other group they did give laser therapy, and they did the laser therapy directly on the thyroid. So if you have Hashimoto's autoimmune thyroid, we utilize laser therapy because the study showed that the laser therapy all by itself, not even including all the other stuff that we do for our patients, it by itself decreased the antibodies to the thyroid and increased the T4 production. So it decreases the autoimmune attack, it improves production of normal thyroid hormone, and then they did before and after ultrasound, and it literally physically improved the structure of the thyroid post laser therapy as well. So if you have Hashimoto's, we include this as a part of your therapy. All right, neurofeedback is really the keystone to our neurological rehab. Neurofeedback is something that we do based on EEG guidance, or QEEG guidance. It stands for quantitative electroencephalogram. If you have symptoms like insomnia, anxiety, depression, brain fog, learning disorders, chronic pain, we're going to do an EEG when you come in for that first visit. The EEG helps us to evaluate how the brain is functioning from an electrical perspective. Just like an EKG measures the electrical activity of the heart, an EEG measures the electrical activity of the brain. And then when we figure out what's going on with the brain waves, if we need to, we can literally re-regulate these brain waves with neurofeedback, and that allows us to decrease the symptoms that you're experiencing. So what happens is if your brain is dysregulated, it's causing potential symptoms. When we re-regulate the brain waves, symptoms go away. And the cool part about this is the results can actually be permanent. Let's walk through this a little bit. So in the initial evaluation, we're doing an EEG, so we put a funky hat on your head. It measures the different points on your brain electrically. That information goes into the computer. We send that to a normative database. It compares your EEG data to thousands of other people your age. We get a report back that shows us what's going on at each of those points with different types of brain waves. And those imbalances that we find, we associate with your symptomatology. So we expect to see certain patterns associated with certain symptoms. And we review that with you when you come back in for your report. So this is what a map would look like. Okay, there's 4 different brain waves that we measured: delta, alpha, theta, and beta. And we're looking for patterns and extremes. So the colors, blues and dark blues, means those waves are too slow. Reds and yellows means those waves are too fast. And greens means they're just right. And so this is an example from an actual patient of ours. This patient actually has ADHD. And we demonstrated that clinically, diagnostically here on the EEG. So there's a particular pattern we expect to see for ADHD. We expect to see delta and theta waves fast, which we do with the yellows and reds, and we expect to see beta waves slow, which we do with the blues and dark blues in the frontal and occipital lobes. So here we see an actual pattern for ADHD in a child that we were looking to see if he had ADHD in. Great news with this is we used neurofeedback for this particular kid, and he saw a dramatic improvement in his symptoms. Same thing for things like insomnia and chronic pain and anxiety and depression get great results with neurofeedback, because when you re-regulate the brain waves, symptoms that were caused by dysregulated brain waves tend to go away. So basically, the training that we do is based on your individual EEG data. It's EEG-driven neurofeedback. and we customize a program for you. And basically what we're doing is we're trying to upregulate or downregulate waves depending upon your symptoms and what we found in the EEG. So for this particular child, I want to downregulate delta and theta brainwaves, and I want to upregulate beta brainwaves to normalize them. When we do that, we get great results. This is how the training works. Basically, we want to encourage your brain to behave better. How do we do that? Well, we set up a reward system for the brain. The reward system is you get to watch a movie. So that's fun for you. You're watching a movie in our office. While you're doing that, you can see this person has EEG electrodes hooked up to their brain. So we are monitoring your electrical activity of your brain in real time, and that feedback, the neurofeedback from your brain, actually controls the playing of the movie. So when we get proper brainwave activity, the movie plays. When we get improper brainwave activity, the movie stops or slows down, your brain gets upset and says, hey, I want that reward. When it learns the proper behavior again, the movie will play again. So it's a constant learning system for the brain. When the brain eventually learns on its own what proper brain waves are, it will continue to produce those brain waves, expecting the reward. Eventually we can remove the reward when therapy is done, and it will continue to perform and produce proper brainwave activity. Proper brainwave activity leads to an alleviation of symptoms. The cool part about this is that they've done before and after MRI studies of the brain with neurofeedback. Actually shows that we've created new structural connections in the brain. So literally we've changed the physical structure of the brain. This is what we call neuroplasticity. So the results can be permanent because we've literally changed the structure of the brain. So that's really the best part. The changes that we make are made for life with neurofeedback. Another good thing about neurofeedback is that it's painless, it's drugless, it's non-effective, there really are no side effects, and it's extremely effective. And if you watch our video on ADHD and how we help those kids, we go through the evidence that shows how effective it is, in particular for ADHD and focus and attention and memory type issues. Okay, so back to the testing that we do. We just went over the neurological testing. I went over all the functional medicine and endocrinology testing before. Why doesn't your primary care doctor do these tests? Because, as you know by now, they are stuck inside this medical box. They can't get outside the medical box because they're driven by the insurance companies and the pharmaceutical companies. Inside that box, you don't get your symptoms resolved. You don't have a change in improvement in your quality of life. We have to step outside that insurance, pharmaceutically driven box. We can do what you need to have done for your body to function optimally, and when we do that, we get great results and your life is literally changed. So they don't do antibody testing for thyroid, and I talked about that. And the reason why is because it doesn't change their therapeutic protocol, so it's not going to be covered by insurance. If you Google Hashimoto's, so you go to Google and you type in Hashimoto's, the second or third link is going to be for the Mayo Clinic. And the Mayo Clinic says that Hashimoto's disease is a condition in which your immune system attacks your thyroid. Hopefully you've learned that by watching the video. The last statement says that treatment of Hashimoto's disease with thyroid hormone replacement is usually simple and effective. And I would wholeheartedly disagree with that, because we have scores of patients coming into our office that have Hashimoto's and their thyroid symptoms are not improved with thyroid hormone replacements. In fact, the study that was done with the low-level laser that I pointed out earlier, they specifically said in the first paragraph of their study that currently there is no effective therapy for chronic autoimmune thyroiditis. So this is in direct contradiction. These researchers directly contradict what is said on the Mayo Clinic website. So what do we do for our patients? We use individualized programs. Everybody's different, so your therapy is going to be different. It's going to be based on the testing that we do. It's very specifically individualized. Some of you may need to stay on medications. Like I said, I'm not telling you to stop taking your medications. If you have what we call the primary hypothyroidism, remember I said that's primarily effective or effectively managed with thyroid hormone replacement. So you may need to stay on the thyroid hormone for that, but we might need to still address other areas. The goal is to renew the function of your neuroendocrine system, and when we do that, we restore your quality of life. And really, that is the most important thing. Restoration of your quality of life, that's what you're here for. You want to get your life back. People come in all the time saying, I just want to be my old self again. And we have people leaving our office saying, literally, I'm my old self again. And how cool is that to have your life back? So now we're going to give you a couple of examples of patients that had their lives changed through the therapies that they received in our office. Enough of me talking. I want you to see some real-life examples of patients that are doing so much better after they've stepped outside of that pharmaceutically driven, insurance driven model and made the investment in terms of time, money, and energy into their own health. They've taken control of things and now they literally have their lives back. First patient we're going to look at is Cheryl, and then we're going to listen to Sharon as well.
WLFJ Talk Radio. I heard you do a commercial. You were telling that we could come in and watch you in a seminar, and sat through the seminar, and I knew that you knew what you were talking about. So many things that you mentioned I was struggling with, and I was just convinced that you could help me. Before I came in, I was having problems sleeping at night. I mean, like maybe every 15 minutes waking up. My hands were going numb, tingling at times, and because I wasn't sleeping at night, I couldn't stay awake during the day. That was the worst of it. I did have a little bit of pain in my feet, but that was just early in the morning. But the worst of it was just sleep. My sleep was all messed up, all messed up. Well, going to some nutritionalists, went to Whole Foods, I started doing a little bit of research, found that I was probably lacking in certain vitamins. I tried to treat it myself, and that was not working. It probably was only about 2 weeks that the sleep became so much better. Sleep is so important. I cannot tell you how much better it was to be able to sleep for 2 hours straight, 3 hours straight. Within 2 weeks, I was not wanting to sleep during the day. So I felt like my whole sleep, just because it got better, I got better. The tingling of the hands was a little bit slower, but it came along too, within probably a month to 6 weeks. Right before I started with you, I had started having a lot of indigestion, and I have never had that problem. And probably within a month, just burping. I mean, like eating or not eating, it didn't have anything to do with it. I would be burping, and then that stopped too. So I've been very pleased. I would highly recommend them come sit through your seminar, hear what you've got to say. I would highly recommend this to anybody, to my family, to my friends. And I have highly recommended it to my family and my friends. I am very thankful. I am very thankful. I had to do a lot of changes in my life, change my diet, which was huge. And whatever you told me to do, I did it. I think that's key. People have to get on board, completely on board with what you're telling them to do. You can't halfway do it. And I've been pleased. I'm expecting even greater results. I had terrible brain fog. I couldn't remember things. I was in major pain with the fibromyalgia, and just a very deep depression, and my anxiety was really bad. I didn't talk to people. I didn't go anywhere. I'd go to the grocery store if I had to, but that was about it. And so I just wouldn't go anywhere. I'd stay at home. The pain management got better, and the best part of it was when the brain fog started going away, because that just messes everything up. So that getting better, and my balance got better, because I was falling a lot and just afraid to do things because my balance wasn't good. And that got early on, that got improved. But
that and just having a more secure feeling about myself, I guess. It's like getting a new life. It's, I'm getting out, I'm talking to people, I'm not just at my apartment complex, but I'm going places. I've actually been doing some shopping, which I haven't done in over a year, and enjoying it. And just, I'm getting up in the morning and staying up instead of just wanting to go lay back down. And I'm staying up longer. And just, it's like I just all of a sudden feel like living again, and I feel like participating in things again. As my daughter put it, she said, all of a sudden you're just posting on Facebook like crazy and you've never done that. I said, hey, I'm just enjoying it. Definitely do it. I've encouraged several people that I've told about it. And I told them, I said, you have to kind of work through to find out which is the right thing. You may have to go through one or two things to find out what's going to work the best. Now, the hardest thing for me was the diet, as you know. The best thing was getting off the medication that I was on that was doing me a lot of harm. And that in itself is a blessing. You know, I don't have to take that anymore. And just, I never thought that I'd want to feel like living again, and I actually do. Now I get up in the morning and thank the Lord for that I woke up. And I wasn't doing that before. I was going to bed asking Him to take me home. So it's just completely different, like night and day.
Well, I'm so happy.
Mm-hmm. I am enjoying being me for the first time in a long time. And I'm not crying.
Weren't those stories amazing? If you want to have a story for yourself like Cheryl or Sharon, and you've liked what you heard today, here's what you need to do. You need to come into our office. When you come into our office, we're going to do a one-on-one consultation with you. Basically, before you even get to the office, I'm going to review your case so that when we sit down, you and I'm going to talk about what's going on, where you've been, where you are now, where you want to go in the future. I'm going to do the functional neurological exam with you, and we're going to determine how the brain is working. If we need to, we'll do the QEEG, and then we're going to bring you back for a second appointment, and that's where I go over the recommendations based on the findings from your exam. Normally, the consultation and the exam is $300. Normally, the EEG is another $395. If you make an appointment after watching today's DVD, you can do that for only $99. The initial visit and the follow-up report and the QEEG, even if necessary, are included in that cost. At the exam, we're going to make potential recommendations for initial blood work. So most commonly what I'll say when we're done with that first visit and the consultation and the exam, I'm going to say, you know, maybe we need to do that genetic test for $99. And commonly I'll also say, let's order the initial blood work, the comprehensive panel, the blood panel that I talked about initially with the full thyroid workup, the lipid, the liver, kidney, adrenal markers, all that stuff, inflammatory markers. I would typically say let's order that as well, and that's $299. So normally I'll make those recommendations. This way we have a complete picture almost at the report where I go over the findings and let you know exactly what we need to do moving forward. Like I said, at the report we'll go over all the findings, we'll make a recommendation for any additional therapies. If we have blood work done at that point, we'll go over that with you. And then we'll let you know exactly what the details are in terms of costs and payment options, literally down to the penny. At that second visit, you'll know exactly what your responsibilities are. We do have a very rigid screening process, so we do not accept all patients. We do not accept smokers, and I'm not trying to beat up people who smoke. It is an addiction, and there are issues with that, and I understand that. But it's a huge barrier to you getting better. So if we do all these things and you're still smoking, I can't get over that hurdle without you taking care of that yourself. So keep that in mind. Okay, some other requirements. Your health has to be your top priority. So if you're helping mom or dad or a child or grandchild with their health, That needs to be your priority, but that means your health is not your priority. So maybe you need to think about coming back at a later time when you can focus on yourself. And then once you get yourself better, you'll be better able to help others and loved ones in your family as well. You have to bring your significant other to the second appointment. That's the report of findings. Now, I prefer you to bring them to both, the initial consultation and the report, but you absolutely, positively must have them at the report. We're going to be going over exactly what's wrong with you, what we need to do in terms of additional testing, how we're going to get you better, and then what the costs are. And so your significant other needs to be a part of that process. Okay, we will not schedule that appointment unless you understand that and have agreed to bring them. Because if they don't understand what we do and how we're different and what we're going to do to get you better, they're not going to be able to support you. And if they can't support you, they're going to sabotage you and you're not going to be successful. And I don't want to waste your time and energy and money if you don't have the support system that you need to get better. So that's really important that they be there. Now, if you don't have a significant other, you don't need to go out and find one in order to be able to come into the office. Obviously, that would be way more stressful and just make things worse. So no worries there. You have to have the right attitude. So some people, they just like the sympathy they get from the symptoms that they're having. So if that's you and you just kind of want to bounce from doctor to doctor and not really get any better, please don't make an appointment. You have to take personal responsibility. So you have to make lifestyle changes. For some people, lifestyle changes, the biggest ones are the diet. So if I say that you can't eat gluten, that means no breads and pastas, potentially for the rest of your life. I can tell you right now, I'm going to tell you never to drink soda again. Okay, so if you're not ready, willing, and able to do those things, then you're not going to be successful, and I don't want you to waste your time. Okay, I can't care about you more than you care about yourself. So if you're not willing to invest that effort, then I can't help you. Okay, and for some people, it could be an activity that you like doing. I have a patient that came in for an evaluation, and this person likes to play hockey, but he has a brain issue. Hockey, as you know, is a contact sport, and you get bumped upside the head every time you go play. So he has to weigh the cost. Do you want to continue playing hockey? Well, then maybe I can't help you. Or you want to start getting better? Then maybe you have to stop playing hockey. So lifestyle changes are extremely important. Time commitment. So there's things you're going to have to do at home, but also you might have to come into our office. On average, a patient comes to our office twice a week. Okay, so you got to think about that. And you know, sometimes people live a distance away, but they're committed. And some people drive literally an hour and a half to our office twice a week, one way, 3 hours round trip, because they're getting their lives back. So you got to weigh how important that is to you. Like I said, I've been pounding this the whole time. Once we step outside of that pharmaceutically insurance-driven model, insurance is not going to pay for a majority of your care, okay? So if you think that insurance should pay for 100% of the care, then this is definitely not the right place for you. We are outside of the mainstream. We're outside of that medical box, but stepping outside of that box allows us to get you your life back, as you've seen already in the video. Most people in our office, however, can get the care that they need for anywhere between $200 and $400 a month for 18 months. Now, you're not in our office getting therapies for 18 months, but you can extend the payments out to 18 months, and you can do that with no interest, so there's no additional cost on your part. Okay, so we'll go over all those options when you come in for that second appointment. You can make your decision about what you want to do. But let me put that into perspective for you. $200 to $400 a month is probably less than a car payment. And a car payment does not get you your life back. And car payments last 5 or 6 or 7 years. This is a year and a half. It's going to get you your life back. Where is it on your priority list? Let me give you another example in terms of comparison. Remember I said that thyroid disease, which is an autoimmune disease, once you have one autoimmune disease, you can have more than one autoimmune disease? Well, one of those other autoimmune diseases that you can have is multiple sclerosis. I found a post on Facebook where a patient was complaining about the copay for her multiple sclerosis medication. And maybe she's not even getting better with the medication, but here's what the copay was. $2,079.37 for one medication, and that's with the insurance involved. That's the copay after the insurance pays. So just keep that into perspective, and this lady might not even be getting her life back. We're going to get you your life back, and it's going to cost a whole lot less than that. Okay, so when you make your appointment, please keep your appointment. Please be respectful of our schedule, and we'll be respectful of your time as well. You need to bring or wear shorts and a t-shirt. If you come dressed like me, I will not be able to evaluate you properly in terms of neurological exam, and I'll have to put you in a funny hospital gown. So make sure you have shorts and a t-shirt. There's going to be 2 parts to your application. There's going to be an online portion and a paper portion. If you come into the office or you request us to mail the paper portion, we can do that. We can also send it to you by email. Just talk to our team. They'll get you all set up. But the paper portion must be filled out before you come back to the office. You're going to bring the paper portion with you to the first appointment. There is an instruction sheet on the first page. Please read this carefully. This has all the details in regard to what to expect. If you have any questions, read this first page, read it a couple times, and then if you have questions, give our office a call. We want to make sure that this process runs as smoothly as possible so we can get you feeling better as quickly as possible. You're also going to get a link through email through a company called FM Logics. That is our online portion of our intake paperwork. You have to fill out all of the questions on the FM Logics. Please be as detailed and as thorough as possible. The more information you put in there, the better we'll be able to evaluate your case before you come in. If you leave things out, then that's not going to be information that I can use to the best of my ability to get you better in the best way possible. So fill that out as best as possible. That online portion must be completed 24 hours before you come into your appointment. So if you're coming in on Monday morning, have it done on Thursday evening, because we're done with our office hours on Thursday evening. Your significant other has to have watched this video. So if you're sitting on the couch by yourself, please rewatch the video with your significant other. They have to, and you have to sign just a form stating that you've watched it. Remember, I talked about support or sabotage. Hopefully by now they've realized I'm not just a regular chiropractor, just going to crack a neck and back and things like that. We do a whole lot of different things to help people with chronic conditions, and they will not have understood that if they haven't been here watching this with you. Okay, if life happens basically and you have to reschedule your appointment, no problem. Just give us 24 hours notice. We'll be happy to do that for you. If you don't give us 24 hours notice, or you don't tell us by Thursday of the previous week for a Monday appointment, or you don't have your paperwork on the day of the appointment, or you don't have the online portion filled out before you 24 hours prior, or if you haven't watched the video with your significant other, you're going to have to reschedule your appointment. If for any of those reasons we have to reschedule, you will have to pay the $99 again, because that will have been a wasted hour that we could have been helping someone else. We do have a waiting list, so sometimes people can't get in here for 2-3 weeks because we're very busy. So if that's the case, get your paperwork in as soon as possible, and then as soon as we have a cancellation or opening, we can slide you in. We have basically a pile of people who have all their paperwork done. We call them when we have an opening, and we can slide you right in. Okay, at this point, I want to encourage you that knowing but not doing is like not knowing at all. So even if you just take some of the tips that I talked about, things you can do at home, and use that information, you're one step ahead of the game. But I can't help you unless you now take the next step. Okay, you have to get outside of that medical box, that repetition of doing the same thing over and over again, expecting different results. Avoid the insanity. Now's the time to take action. So I want you to think about a couple things. If you're sick and tired of being sick and tired, how has it impacted your relationship with a significant other, with friends, with family? A lot of times people just aren't motivated to do anything anymore. You get up in the morning, you're so fatigued and tired, you don't want to go hang out with Betty and play bridge on Tuesday, you don't want to hang out with your kids on game night Friday night. You don't want to do these things anymore because you're just so exhausted and drained. What's it cost you in time, money, and happiness? I had a patient come in. She was with her husband, as she was supposed to be at the report, and she turned to her husband and she said, up to this point, has my thyroid issue cost us money? And he said, yes, it has. And so your thyroid's going to cost you money one way or the other. Why don't we invest that money wisely and get you to the point where you get your life back again, and then it won't cost you money anymore? What's it going to look like in 3 to 5 years if you don't get it taken care of? And the reason why I asked this question is because I looked down at the scale a couple of years ago, saw a number I had never seen before, didn't want to ever see again. And I literally thought to myself, what's this going to look like if we keep going in this direction? It was just going up and up and up. I made a decision that day to never see that number or anything higher than it ever again. Since that point, I've lost 30 pounds. I have not gained it back. And literally, it was because I asked myself that question, what's this going to look like in a couple of years? So what's it going to look like for you in a couple of years? And what's it worth to get your life back? And really, for a lot of people, it's not really the money that's the most important thing, or the biggest roadblock. It's really being able to make those lifestyle changes. So if we say you can't eat gluten anymore, or you can't drink Diet Coke anymore, if you're not willing to do that, then again, I can't care more about you than you care about yourself. Where are you on a scale of 1 to 10? Of 10 being you'll do absolutely anything to get your life back. Okay, if you're an 8, 9, or 10, you're probably a good fit for the program. If you're 7 or below, you're not ready yet. Basically, literally, you're just not sick enough. Okay, so we can move on. We'll help the next person who's ready to go. And then what's your reason why? Why do you want to get better? You have to have an underlying driving force. What is going to change in your life? What's going to get better about your life when you get rid of your symptoms? What things are you going to be able to do that you haven't been able to do before? If your why is big enough, if you have that underlying driving force to do the things you need to do to get better, then you can be extremely successful. So I look forward to helping you out in the office. Give our office a call, 864-757-8500, and we'll see you soon. Have a great day. Take care.